Older women, stop doing these 7 things with your underwear. From a doctor. As a physician who has worked with thousands of women over 60, I can tell you that some of the most common health complaints I hear, persistent irritation, recurring infections, unexplained discomfort, often trace back to something women rarely think to discuss with their doctors, their underwear habits. What might surprise you is that practices you've followed for decades may no longer be appropriate for your changing body, and small adjustments in how you choose, wear, and care for your underwear can make a dramatic difference in your daily comfort and intimate health. Gynecologists and dermatologists who specialize in mature skin and women's health have identified specific underwear-related habits that become particularly problematic after age 60, when hormonal changes, thinning skin, and altered pH balance make the intimate area more vulnerable to irritation and infection. The good news is that these issues are completely preventable once you understand what your body needs now versus what worked for you in younger years. Dr. Mary Jane Minkin, a clinical professor of obstetrics and gynecology at Yale School of Medicine, who has spent decades studying postmenopausal health, emphasizes that the intimate area undergoes significant changes after menopause that require different care approaches. The decline in estrogen affects tissue thickness, natural lubrication, pH balance, and the protective bacterial environment. These changes mean that underwear choices and habits that were fine in your 30s or 40s can now contribute to discomfort and health problems. Before we explore these 7 critical mistakes, it's important to understand that this conversation comes from a place of genuine medical concern for your comfort and well-being. Many women feel embarrassed discussing intimate health issues, but there's absolutely no shame in learning how to care for your changing body appropriately. Every woman who lives long enough experiences these changes, and understanding how to adapt your habits is simply good health management. The first major mistake that gynecologists consistently observe in women over 60 is continuing to wear synthetic underwear materials, particularly polyester, nylon, and other non-breathable fabrics. While synthetic underwear might have been comfortable and convenient in younger years, textile scientists and dermatologists explain that these materials become increasingly problematic as skin ages and hormonal changes affect the intimate environment. Synthetic fabrics don't allow proper air circulation, which creates a warm, moist environment that promotes bacterial and yeast overgrowth. As we age, declining estrogen levels already make us more susceptible to infections because the natural protective bacteria in the vaginal area become less abundant. Wearing synthetic underwear compounds this problem by creating conditions where harmful bacteria and yeast can thrive. Dr. Jessica Shepard, a gynecologist who specializes in women's health across the lifespan, explains that mature skin is also more sensitive to irritation from synthetic materials. The chemicals used in manufacturing synthetic fabrics, the dyes used to color them, and even the way synthetic materials trap moisture against sensitive skin can all contribute to persistent irritation, itching, and increased infection risk. The solution is transitioning to 100% cotton underwear, which allows proper air circulation, wicks moisture away from skin, is naturally hypoallergenic, and creates a healthier environment for beneficial bacteria. Look for underwear labeled as 100% cotton in the crotch area at minimum, though ideally the entire garment should be cotton. Avoid underwear with synthetic lace or trim in the intimate area, even if the main panel is cotton. The second critical mistake involves wearing underwear that's too tight or has elastic bands that dig into skin. Many women continue wearing the same style and size of underwear they've worn for years, not realizing that body shape changes with age, require different fits. Tight underwear or restrictive elastic can cause multiple problems that become more serious as we age. Dermatologists who specialize in aging skin explain that mature skin is thinner, more fragile, and less resilient to pressure and friction. Tight elastic can cause skin breakdown, irritation, and even contribute to urinary tract infections by creating pressure that affects proper emptying of the bladder. Additionally, tight underwear can restrict circulation and lymphatic drainage, contributing to swelling and discomfort. Many women don't realize their underwear is too tight because weight distribution changes with age. You might be the same overall size, but carry weight differently, particularly around the abdomen and hips. Underwear that fit perfectly 5 years ago might now be creating pressure points that lead to irritation and health problems. Gynecologists recommend choosing underwear with wide, soft, elastic waistbands that don't dig into skin, ensuring adequate coverage that doesn't create pressure points. Considering sizing up if you notice any elastic marks or indentation on your skin, and trying different styles to find what works best for your current body shape. The third problematic habit is wearing underwear multiple days without washing, or not changing underwear if you've been sweating or experienced any incontinence. While this might seem obvious, healthcare providers report that many older women have developed habits of wearing underwear for more than one day to reduce laundry, or because they don't think their underwear is dirty enough to wash. Infectious disease specialists and gynecologists emphasize that this practice becomes increasingly problematic with age. Throughout the day, underwear accumulates bacteria, dead skin cells, natural secretions, and traces of urine or fecal matter that you might not even notice. When you wear this underwear again without washing, you're exposing your intimate area to accumulated bacteria that can lead to infections. This issue becomes even more important for women dealing with any level of incontinence, which affects up to 50% of women over 60 to some degree. Even minor urine leakage creates a moist environment where bacteria multiply rapidly. Wearing underwear for multiple days when you're experiencing any incontinence significantly increases your risk of urinary tract infections and skin breakdown. The practice should be to change underwear daily, without exception. Change immediately. If you experience any incontinence or excessive sweating, consider changing midday if you're very active or live in a hot climate, and have enough underwear in rotation so daily changes are easy and convenient. The fourth mistake involves using fabric softeners and dryer sheets on underwear. Many women use these products on all their laundry, including underwear, without realizing that the chemicals in fabric softeners can irritate sensitive, intimate skin and disrupt the natural pH balance that protects against infections. Textile care experts and dermatologists explain that fabric softeners work by coating fibers with chemicals that make them feel softer. However, these chemical coatings can irritate mature skin, which is more sensitive than younger skin. Additionally, fabric softeners reduce the absorbency of cotton fabrics, which defeats one of the main benefits of wearing cotton underwear in the first place. Chemical sensitivities often increase with age, and women who never had problems with fabric softeners in younger years may develop irritation and sensitivity as they get older. The fragrances in fabric softeners and dryer sheets can be particularly problematic as they contain multiple chemical compounds that can trigger allergic reactions or irritation. Gynecologists and dermatologists recommend washing underwear without fabric softeners or dryer sheets, using fragrance-free hypoallergenic detergents designed for sensitive skin, ensuring thorough rinsing to remove all detergent residue, and avoiding any laundry additives that leave chemical coatings on fabrics. The fifth mistake that healthcare providers frequently observe is wearing thong-style underwear, or underwear with minimal coverage. While thongs might have been fashionable or comfortable in younger years, gynecologists and infectious disease specialists strongly advise against them for women over 60 due to the increased risk of transferring bacteria from the rectal area to the vaginal and urinary areas. Dr. Alyssa Dweck, a gynecologist who has written extensively about women's health across different life stages, explains that thong underwear creates a direct pathway for bacteria to travel from the anal area to the vagina and urethra. This wicking effect becomes particularly problematic after menopause, when declining estrogen levels reduce the protective bacteria in the vaginal area and make you more susceptible to infections. Additionally, the narrow strip of fabric in thong underwear can cause friction and irritation on delicate tissue that has become thinner and more sensitive with age. This constant friction can lead to micro tears in the skin that create entry points for bacteria, increasing infection risk even further. Women over 60 are already at higher risk for urinary tract infections due to hormonal changes and physical changes in the urinary system. Wearing thong underwear significantly increases this risk by facilitating bacterial transfer from the anal area to the urethra. Studies have shown that women who regularly wear thongs have higher rates of UTIs and yeast infections compared to women who wear full coverage underwear. The recommendation from gynecologists is clear. Choose underwear styles that provide full coverage of the intimate area. Opt for styles that have a wider panel of fabric in the crotch area. Avoid any underwear styles that create friction or rubbing in sensitive areas, and prioritize comfort and health over fashion when it comes to underwear choices. The sixth problematic habit involves sleeping in underwear every night, which many women do out of habit or modesty, without realizing that their intimate area actually benefits from nighttime breathing time without the constriction of underwear. Gynecologists and dermatologists increasingly recommend that women over 60 consider sleeping without underwear, or at least alternating nights with and without. Medical research has shown that the vaginal area benefits from air circulation during sleep, which allows moisture to evaporate naturally and helps maintain a healthy pH balance. When you wear underwear to bed, especially in a warm, sleeping environment, you can create conditions that promote bacterial and yeast overgrowth during the 8 or more hours you're sleeping. Dr. Jennifer Gunter, a gynecologist and author who focuses on women's health education, notes that sleeping without underwear is particularly beneficial for women who experience any level of incontinence, vaginal dryness, or recurrent yeast infections. The increased air circulation during sleep helps keep the area drier and less prone to irritation and infection. Many women resist the idea of sleeping without underwear due to concerns about hygiene or modesty, but gynecologists explain that sleeping without underwear is actually more hygienic than wearing underwear to bed. Your nightgown or pajama bottoms provide adequate coverage for modesty, and you can protect your bedding by changing sheets regularly, just as you would anyway. If you prefer to wear something for comfort or modesty, consider loose-fitting cotton sleep shorts or pajama bottoms without underwear underneath, ensuring your bedroom temperature is cool enough to prevent excessive moisture buildup, and choosing breathable bedding materials that promote air circulation. The seventh and final mistake is continuing to wear old, worn-out underwear long past its useful life. Many women are frugal and practical about their wardrobes, holding on to underwear until it literally falls apart. But healthcare providers emphasize that worn-out underwear can actually compromise your intimate health. Textile experts and dermatologists explain that as underwear ages and is repeatedly washed, several changes occur that make it less suitable for maintaining intimate health. The fabric becomes thinner and less protective. Elastic breaks down and can no longer provide proper support or fit. Bacteria can become embedded in the fabric fibers despite washing, and the fabric becomes less absorbent and less effective at wicking moisture. Additionally, older underwear often has areas of thinning fabric or small holes that you might not even notice, but these compromised areas provide less protection and can harbor bacteria more readily. The elastic in older underwear often becomes stretched out or brittle, creating areas that dig into skin or fail to provide adequate coverage. Healthcare providers recommend replacing underwear every 6 to 12 months, depending on how frequently you wear and wash them, replacing immediately if you notice any signs of wear like thinning fabric, stretched elastic, or discoloration. Maintaining a rotation of at least 10-14 pairs so each pair gets adequate rest time between wearings, and treating underwear as an important health investment rather than an area to cut costs. Now let's discuss comprehensive strategies for optimizing your underwear choices and habits to support intimate health and comfort as you age. The key is understanding that small changes in this fundamental aspect of daily life can significantly impact your overall well-being and quality of life. When shopping for new underwear, prioritize health over fashion by looking for 100% cotton or cotton blend fabrics with at least 95% cotton content. choosing styles with full coverage that don't create pressure points or friction, selecting soft, wide elastic waistbands that distribute pressure evenly, and avoiding any embellishments, lace, or trim in the crotch area that might cause irritation. Pay attention to sizing, as properly fitted underwear shouldn't leave marks on your skin, ride up or bunch during normal activities, or feel tight or restrictive in any way. Many women find that they need to size up from what they wore in younger years due to changes in body composition and fat distribution that occur with aging. Consider having different types of underwear for different activities and times of day. You might want more supportive styles for active days when you're out and about, lighter, looser styles for relaxing at home, and the option to sleep without underwear, or in very loose sleep shorts for nighttime. Proper laundering becomes increasingly important for maintaining both the quality of your underwear and your intimate health. Wash underwear in hot water when the fabric allows, as this helps kill bacteria more effectively than cold water washing. Use fragrance-free hypoallergenic detergent, specifically designed for sensitive skin, and ensure thorough rinsing by running an extra rinse cycle if your machine has this option. Avoid overloading your washing machine, as overcrowding prevents proper cleaning and rinsing. Consider hand washing your underwear if you have particularly sensitive skin, or if you're dealing with recurrent infections. This allows you to control the water temperature, soap amount, and rinsing more precisely. Air drying underwear in sunlight when possible provides natural antibacterial benefits from UV exposure, though machine drying on high heat is also effective for killing bacteria. Avoid leaving wet underwear sitting in the washing machine, as this creates an environment for bacterial growth. If you're dealing with recurrent infections, consider having a separate set of underwear that you sanitize by boiling or washing in very hot water with a small amount of white vinegars added to the rinse cycle. Some gynecologists recommend replacing all underwear after a yeast infection to prevent reinfection from spores that might survive normal washing. Storage matters too. Keep your underwear drawer clean and dry, rotating stock so older pairs get used and replaced regularly, and avoiding overcrowding that prevents air circulation. Consider using drawer liners made from natural materials rather than scented ones that might transfer chemicals to your underwear. For women dealing with incontinence, which affects up to half of women over 60 to some degree, special considerations apply. Consider using dedicated incontinence underwear or pads rather than relying on regular underwear to manage leakage. Change immediately after any leakage occurs, even if it seems minor. Wash incontinence underwear separately in hot water with extra rinsing, and consult with healthcare providers about treatment options for incontinence rather than simply managing symptoms. Physical examination of your intimate area should be part of your regular health routine. Check for any signs of irritation, redness, or unusual discharge. Notice whether certain underwear styles or fabrics seem to correlate with discomfort, and report any persistent irritation or recurring infections to your healthcare provider promptly. Don't hesitate to discuss underwear and intimate health concerns with your gynecologist. These issues are a normal part of medical care, and healthcare providers want to help you maintain comfort and health. If you're experiencing recurrent infections, persistent irritation, or any changes in your intimate area, your underwear habits should be part of the discussion with your healthcare provider. Remember that intimate health is an essential component of overall well-being and quality of life. Discomfort, irritation, or infections in the intimate area can affect your sleep, your activity levels, your confidence, and your enjoyment of life. Taking the time to optimize your underwear choices and habits is an important investment in your health and comfort. Many women report that making these simple changes to their underwear habits results in dramatically improved comfort, fewer infections, and greater confidence in their daily lives. You don't have to accept discomfort or recurring problems as inevitable parts of aging when simple adjustments can make such a significant difference. Your body has changed over the decades, and it's not only appropriate but necessary to adjust your habits to support your body's current needs. What worked perfectly for you at 40 might not serve you well at 65, and there's no shame in adapting your practices to maintain health and comfort as you age. If this medical guidance has helped you understand how to better care for your intimate health through proper underwear choices and habits, please give this video a thumbs up and subscribe for more practical health information designed specifically for women over 60. Have you experienced any of these underwear-related issues? And which of these recommendations do you think will be most helpful for improving your comfort? Share your thoughts in the comments below. Your experiences could help other women who are dealing with similar concerns. And if you're interested in more content about maintaining health and comfort as you age, be sure to check out our video about other overlooked aspects of personal care that become increasingly important after 60. Remember, taking care of yourself in these fundamental ways is essential for maintaining quality of life and enjoying your golden years to the fullest.